Right now, lawmakers debating whether to lower the bar for involuntary mental health treatment.
It's a big topic, and with this, we wanted to know where Oregon's top Democrat and Republican stand. So we sent Elise Haas to get answers, and Elise, you've been reporting on this particular issue for years now.
Yes, and so last week we also showed you how the lack of mental health treatment led to tragedy, suicide, and homicide in local families.
You shouldn't have to kill your mom to get mental health treatment. But that's what our bright, promising son Austin did to his mom during psychosis.
So we took these stories to state leaders, Governor Tina Kotek and House Minority Leader Christine Drazan. In 2022, Oregon ranked near dead last for access to mental health care. We heard mothers' cries for help.
And as a mom, I'm thinking, they have parents that love them, and they can't get help.
The way we are dealing with it is as crazy as my son.
Then, in 2024, we pressed Governor Tina Kotek on her plan for addressing involuntary commitment issues.
The bar is just so high, and we have to do it carefully, but I think we have to provide some different tools to get people help.
She said lawmakers would tackle civil commitment this year. Now, we're holding her to it.
So I just want to check in to see where do you stand today?
Yes. There has been a lot of good work by community partners, particularly NAMI, over the last year to talk about what can we do to improve criteria for civil commitment to help people get the health care they need when they have decompensated. It's really important. They will have legislation.
Kotek is talking about a new bill lawmakers are considering right now, redefining danger to self and others and unable to provide basic needs, because our current law is vague. Case law has set a precedent that made danger to mean about to commit suicide or homicide, and the inability to provide basic needs so low that we're seeing people suffering with mental illness on the streets. The bill, backed by the National Alliance on Mental Illness, or NAMI, allows commitments if harm is likely within 30 days and clarifies criteria for those unable to meet basic needs.
I have expressed to legislative leaders who are working on the bill, this is important. We need to talk about this.
NAMI leaders say the Oregon State Hospital is now almost entirely for those with mental illness who have been charged or convicted of crimes. They're pushing to keep people with severe mental illness out of the criminal system. So is Kotek.
I believe we can catch some of those folks earlier.
NAMI told Coin 6 the state must help families access mental health care earlier, before crises turn dangerous.
Improvements in civil commitment are necessary. And I agree with NAMI, we have to also make sure that communities have the resources when someone has been stabilized to go to.
The Commitment to Change work group recently released recommendations to lawmakers to improve civil commitments, but some families feel it was watered down due to the requirements for full consensus.
So I was just curious if you've seen those recommendations, what your thoughts are, and if the legislature had an appetite to take it further.
I agree. I don't think they went far enough. What they're recommending, I would put in the housekeeping category and should get done. And I think we need to go further.
We wanted to know how leaders on the other side of the aisle feel about this issue.
There is an appetite to take up issues around civil commitment. That's incredibly important.
House Republican leader Christine Drazan says the first thing the state needs to do is open up treatment beds for people in the community.
It is incumbent on the governor herself to be able to commit to prioritizing more beds for people that need that level of care. We're talking about no access for people that haven't committed a crime who so desperately need intensive residential supports. And there's just nowhere for them to go right now.
I've talked to a couple of families who were involved in the Commitment to Change work group.
Oh, good.
And, they have experienced extreme loss from suicide to homicide within their families due to mental illness. Yeah. And they were very frustrated that the work group required consensus.
Yeah, I really do think that the families that have that direct experience are the ones that we should be listening to right now.
It's unclear where this bill will land, but both parties appear to be prioritizing people who've long been neglected. And NAMI is finalizing an amendment to their civil commitment bill right now as we speak, focusing on some precise wording for 2 key terms. They hope to wrap up the language this week or next. Whether the bill gets a hearing really will depend on the progress of ongoing meetings that are happening this Friday. So NAMI told me that they are committed, though, to keeping their bill intact.
Okay, so Elise, you did mention that Oregon ranks low when it comes to access to care. It's eye-opening. Let's say this involuntary treatment standards, they are lowered. Question is, will there be enough treatment available?
So right now, as it stands, of course, there's not, but NAMI also submitted some companion legislation that would speed up and accelerate the development of residential treatment to go alongside this bill to lower the bar for civil commitment.
And I recall the town hall that you and I did, and the mother whose son died on the streets of Portland because she could not get him into mental health treatment. She wasn't allowed to. Just broke your heart, that story.
And you know what? Like, as I've continued to do these kinds of stories over the years, you know, you find more often that she's not alone.
Yeah.
Yeah. All right. Great report, Elise. I know you'll stay on top of this. Thank you so much.
Yeah, thank you, Elise.